Prende ora la parola il dottor Giovanni Lo Storto.
A lui vuole porsi e proporsi come un centro di ricerca.
Trade, as far as vaccines are concerned, is very important because of the supply chains for vaccines. We monitor the export restrictions and prohibitions of our members. And of course, this has an impact on supply chains. So we try to work to reduce these restrictions and prohibitions so that inputs for vaccines and outputs can flow more freely. That's the first point. The second point is that the WTO Secretariat has been working with convened manufacturers of vaccines to work with them specifically on their supply chain issues, but also to work with them on investing in emerging markets and developing countries.
Okay, perfect.
So if we can achieve those, put in global governance, bring out the money to help finance this, especially helping poor countries. We're also saying the poor countries should spend 1% more of their GDP on strengthening their own health systems, so they too have to contribute. Now, I think we need the political will to have this adopted. If we miss this opportunity to prepare for the next pandemic, our children will not forgive us, because now we know the lessons, and we need to learn those lessons. So I'm hoping that the leaders will, have that political will to adopt some of these recommendations for the next pandemic.
Our Vice President, Professor Paolo Severino.
There are some parts of the world that are moving along faster and recovering faster from the pandemic for two reasons. They have access to vaccines, and they have the fiscal space for fiscal stimulus to their economies. So they are forging ahead. This is Asia, Europe, and North America. On the downward side of the K-shaped recovery are three regions: the Middle East, South America, and Africa, that are not recovering as fast for the same two reasons: the issue of fiscal space and access to vaccines.